Hi, so today we are going to talk about a very tricky topic. We'll talk about how do you differentiate between Guillain-Barré Syndrome or GBS from compressive spinal pathology like slipped disc or spinal stenosis. Guillain-Barré Syndrome is a rare neurological disorder wherein the body's own immune system starts attacking the nerves. This condition is usually painless. This condition usually happens after a viral infection or a stomach infection in the form of diarrhea. Patients usually complain of tingling or numbness that starts in the feet and then the symptom starts progressing upwards. Common symptoms include weakness or tingling in the feet that often progresses upwards. Many times deep tendon reflexes such as the knee jerk, ankle jerk are lost. In severe cases, patient may have difficulty standing, walking and even breathing. GBS syndrome is a medical emergency. If you are having any of these symptoms, it is of utmost importance that you consult a trained doctor immediately. Now let's talk about compressive spinal pathology such as prolapsed disc or spinal stenosis. This condition usually happens when disc material which is bulged out from the disc or a mechanical compression in the form of bulging of ligamentum flavum presses on the nerves, and this causes pain, weakness or numbness in the hands or legs. Here's what sets them apart. Compressive spinal pathology are usually quite painful as compared to GBS, which is usually a painless condition. Many times the symptoms aggravates on specific movements such as movement of the neck or your back. Depending on which nerve is involved, the pain may radiate along that nerve root involvement in the form of dermatome or myotome involvement. This condition is usually progresses over a couple of days or weeks, whereas in GBS syndrome the symptoms progress quite rapidly. Unlike GBS syndrome, where the symptoms progress from feet upwards, spinal pathology is usually defined to a specific location. Whereas GBS syndrome is treated medically and is an emergency, spinal pathologies often require surgical intervention in the form of endoscopic surgery. Thus, both the conditions require medical attention but are treated quite differently. If you know someone or if you yourself are suffering from any of these symptoms, it is best if you can consult a spine surgeon or a neurologist near you.